Hello guys, welcome to the new tutorial on pericarditis. This is very important topic. It can come in your exam. Pericarditis, as the name describes, it is quite self-explanatory. This is an inflammation of the pericardium. The patient usually presents with a sharp stabbing chest pain, and they feel the pain gets worse when they breathe in or when they lie down, when they cough, when they lie on their side, especially in the left side. So those are the presenting symptoms when the patient comes. The important part in this kind of situation is taking a good professional history, site onset, character radiation, timing of the pain, and severity of the pain, and relieving and aggravating factors. These are important to find out. In most of the situation, the patient has a background of recent chest infection or throat infection, cold, flu-like symptoms. Those are mainly the trigger factors. Any viral illness can cause pericarditis. So it is important when a patient, especially a young patient, comes with a chest pain which is lasting for a few days, they are more likely the patients coming with the pericarditis. In comparison to the pericarditis, myocardial infarction pain are momentarily, they get worse with exertion. So in pericarditis, they do not have any particular relation with the activity. They carry on, and the pain is more constant and lasts for few days to few weeks before the patient comes to you. Talking about the findings on examination, the patient usually presents with the tachycardia, may have the fever as well, and tachypnea, tachycardia, fever. Those are the important findings on the observation, and on clinical examination they may have the murmur. Depending upon the severity, sometimes they may be dehydrated if the patients are having some problem with the swallowing or they have been vomiting. The patient may also have hypoxia because of the breath holding, because they feel difficulty in breathing. So those are the important points in your clinical examination. Talking about the investigation, it is important that we investigate the patient properly, thoroughly, and to avoid missing any important and cardiac emergencies, pulmonary emergencies. In the cardiac emergency, the patient may have myocardial infarction. So it is important that we do troponins as well as we do D-dimer and routine investigations. It is also important that we perform all the routine investigations, including chest x-rays as well as ECG. The patient may have abnormal cardiac function, so getting an echo is also very important. However, it does not happen in the emergency department in most of the situation. About the management, this patient, any patient with the pericarditis, can be managed conservatively after we've confirmed the diagnosis. A good detailed history, a thorough examination, and detailed investigations are important before we come to the conclusion. After we decided and we diagnosed that this is a pericarditis, then management is quite simple. The patient can be treated with ibuprofen, paracetamol, over-the-counter painkillers. In most of the situations, most of the cases, they improve, they start feeling well in few days to few weeks. However, in few instances where the patient do not improve, we may need to give them colchicine. Colchicine is a first line drug for pericarditis. In few situations where the patient did not respond to colchicine, then the next drug that we can use for them is steroids. If that fails, then we may need to keep the patient on high dose steroid for longer period of time, and most of them respond. There is another form of pericarditis where the patient may have the bacterial infection and should be treated with the antibiotics. So having routine investigations, including full blood count, UNEs, LFT, CRP, That is also very, very important. Every time the patient comes with the symptoms, we need to do all the investigations again to look for the interval change. If there is no change, then likely we can continue with the conservative management. Then, while making the plan, it is important that we check the patient's sport, if they need any sport, if they can cope at home. It is important that we explain the condition to the patient. They may be worried about the myocardial infarction, or in other words, a heart attack. Explain to them clearly in layman language, in simple words, that this is the inflammation of the covering around your heart. It is not the heart attack. It is also important that we explain to them the signs and symptoms of myocardial infarction, because a patient may develop myocardial infarction, so we do not want the patient to be confused between two of them and keep sitting thinking that it is just a pericarditis. So ask them to contact 999 if they get any worsening symptoms, if the symptoms are not improving, if they start developing any swelling of the legs, which may be suggestive of failing heart. So it is important, ask the patient to come back to the A&E, otherwise the patient can be managed at home. Patient may need a sick note. It is important we give them leaflets about the condition, refer the patient to the cardiology, and ask them to go and see their GP as well. And if they do not feel well, come back to us. This is all about pericarditis. Now let's talk about a typical scenario that we can see. There you go. So this is a young 22 years old gentleman who has come with the chest pain. You are working in the emergency department. So from an emergency point of view, it is important that we take detailed history and rule out any other cardiac problems. In most of the situation, they have underlying or the background infection. Viral infection is one of the major trigger that can lead to the pericarditis. So let's see the background of this patient and we take it from there. So this is a young male who has come to you with the chest pain, and the pain started about a couple of days ago, and the pain is dull, central, 4 out of 10. So which means that it is not as severe. We see the patient coming with the myocardial infarction, they have severe pain. However, it is also important you ask the patient to find out whether the pain is increasing gradually with the passage of time. So do a comparison, ask them how is your pain now and how the pain was when it first started. Now this patient had the viral illness in the past medical history. This is a young patient, viral illness 10 days ago and no other past medical problems, and he is allergic to peanuts. So management is quite simple in this patient. As long as all the investigations are normal and the ECG is also normal, then we can send the patient home with the safety nets and red flags, making sure that the patient understands their condition, making sure that the patient knows when to contact the 999, and making sure that the patient has all the contact details up to date, just in case if we need to contact them. This is all about pericarditis. I hope you learned and you enjoyed. Keep it up. Thank you.